Come in.
Hi, I'm Nurse Patricia. I'll be here to do your physical assessment. Is that okay?
Yes.
Okay. All right. Can you please verify your name and date of birth?
My name is Lane Houston, and my date of birth is October 13, 2004.
Okay. Can you verify where you are today and today's date?
The doctor's office.
Okay. And today's date?
June 3rd, 2020.
Okay. Are you having any pain?
No.
Okay. First, I'm going to perform hand hygiene. And I'm going to don gloves. First, I'll be looking at your head, your front, and your back to verify if there's any open areas, any skin lesions, or any bleeding noted, okay? All right. Okay. Hair color and texture is well within patient's ethnicity. There's no open lesions or any open areas noted. Okay. And now I'm gonna look in your eyebrows and your eyelids and inside your eye. Okay. Eyebrows are good. Conjunctive sclera is clear. No drainage noted. Okay. And let's see. Now I'm gonna ask you to look straight ahead and close your eyes. And I'm gonna put a scent in front of you. And if you could tell me what scent that is and if you smell it.
It smells like coffee.
Okay. All right. And that is assessing cranial nerve number 1, smell, the olfactory nerve. Okay. Now I'm going to, if you could open your eyes, I am going to shine a light. If you could look straight ahead in your pupils. Just look straight ahead. Okay. All right. Pupils are equal and active and round to light. Now I'm going to take the pen light and I am going to ask you to follow the pen light with your eyes, not your head. If you could look straight ahead. Follow with your eyes. Okay. Okay. All right. Very good. That was cranial nerve number 3. And also I assessed cranial nerve 4 and 6. Let's see. How many fingers am I holding up?
4.
Okay. All right. Good. That is cranial nerve number 2. All right. I'm going to look in your ears and make sure there's no foreign objects noted. Okay. All right. And if you could close your eyes for me, I need you to tell me what side of the sound is coming from.
My left.
Okay. And this side?
Right.
Okay. All right. And that was cranial nerve number 8. That was assessed. All right. Now I'm going to look in your mouth using the pen light. Okay. If you could open your mouth for me. Okay. All right. If you could move your tongue around for me. Okay. Very good. Okay. And that was cranial nerves number 9, 10, and 12. All right. If you could open your jaw for me. Can you move it up and down? Okay. And that was assessing cranial nerve number 5. All right. If you could smile and puff out your cheeks for me, like this. Very good. And if you could wiggle your eyebrows. Okay. And that was assessing cranial nerve number 7. All right. Now I'm going to have the patient shrug your shoulders. Very good. Okay. That was assessing cranial nerve number 11. So now I'm going to move down to the neck. And the neck is midline. I see no edema. I'm checking to see if there's any JV veins, which are not noted in this assessment. I'm feeling the lymph nodes. Okay. If you could swallow for me. Okay. All right. Okay. Now I'm going to inspect your chest. I'm just basically going to listen to your lung sounds, and as I move the stethoscope around, I'm going to ask you to take some deep breaths in and out. Okay? Is that all right? Okay. My stethoscope here. All right. Take a deep breath in and let it out. Again. And let it out. Again. And let it out. Again. And let it out. Okay, now I'm going to do the posterior. Take a deep breath in. Let it out. Again. Let it out. One more time. Again. Let it out. Again. Let it out. Again. Let it out. Again. Thank you. All right, lungs are all clear, post and anterior, no crackles or wheezing heard on auscultation. All right, now, Ms. Houston, I would like to listen to your heart sounds, okay? And I'm going to use the same stethoscope to listen to your heart sounds as well, all right? Okay. All right. To your aortic. Okay. And then I'm going to listen to your pulmonary valve. Okay. Then I'm going to listen to Erb's point, which is your third. And then I'm going to listen to your fourth, which is the tricuspid, and then I'm going to listen to your fifth intercostal space, which is the mitral valve. Okay. Alrighty. Okay. As you stated earlier, you have no pain at this time. Right. How are your bowel movements? When was your last bowel movement?
I think last week.
Last week or yesterday?
Oh, yesterday.
Yesterday? Okay. All right. And if the patient has stated that it was last week, we would definitely see what medications the patient has been taking, because normally the average patient either goes every day or at least every other day. Do you have any problems urinating or going to the bathroom or?
No.
Okay, all right. And your bowels have been like normal?
Mm-hmm.
Okay, all right. And you have a, would you say a okay appetite? You try to eat your vegetables and Okay. All right. Your fruits and all that good stuff. Okay. All right. Okay. So now I'm just gonna listen to your abdomen and with the same stethoscope. So if you could lay back for me, get comfortable. Okay. All right. And we also like to provide privacy and only leave uncover the areas that are not that are being assessed, and cover the areas that are not being assessed. So I'm just gonna set it up a little bit. Okay. All right. And listening to the abscess, I'm going to start in the right lower abdomen, and I'm going to work my way around clockwise. Okay. Vowel sounds are hyperactive in all four quadrants. If it wasn't, I would listen for 5 minutes. Okay, now Miss Houston, I am going to palpate with one hand, but also I wanted to state that prior to me listening, I did inspect the abdomen. You always inspect before you auscultate, and there was no distension, and patient stated that there was no pain noted at this time. So now I'm going to use one hand, and I'm just going to palpate around the abdomen, and if you have any pain, let me know. Okay, so I'm going to start the right lower and just move around the liver, the spleen, suprapubic, and the center. Okay, all right, okay, all right. Also, Miss Houston, with your age, can you tell me when your last menstrual cycle was?
It was last week.
Okay, and was it normal or regular 5 days?
Yes.
Okay, all right, okay. All right, but no, since your period, no vaginal discharge or extra bleeding noted since. Okay, all right. Now I am going to assess the patient's skin. I'm looking for any redness, open areas, and look. You always want to check the bony promises. Make sure there's no breakdown. Okay, and there's no redness. Okay, I'm just going to be looking at your legs and your feet. You could, okay. Alrighty, okay. There's no open areas. Look under the heels. There's no open areas. Okay. All right. Now, I am going to do a neural check. So if I can see your hands, let me cover you back up. And if you could squeeze my hands as tight as you can. Okay. Good. Good. All right. Now, I'm going to touch a finger, and you just tell me which one am I touching.
Index. Middle.
Okay.
Thumb.
Okay. And that was checking the neural and sensory motor. Okay. Now I am going to check your pedal pulses, because when I checked your skin, you didn't have any open wounds, areas noted. So, going to check down here. Okay, and this is your dorsal. And this is your tibialis. Okay. Alrighty. And also, I'm going to check her radial pulses, bilateral. Okay, and they are present. And I'm going to check capillary refill as well. And it is less than 3 seconds. Okay. And I'm going to do the same down here as well. I'm going to check capillary refill. Okay. Okay. No edema or redness noted on the lower extremities. Miss Houston, if you could push against my hand. Okay, very good. Again. Okay, very good. All right. Now, let's see. I'm going to have you roll over, and I'd like to inspect your back. But before that, can I ask you your bottom? Is it okay? There's no redness,
Yes.
no open areas. Okay. All right. So if you could just roll over. Okay. All righty.